are at this forum as one of the bronze sponsors, and I am the managing director of Ultimate Health HMO. Ultimate Health HMO is one of the national health insurance or HMOs accredited by the National Health Insurance Authority in this country. We've been in the business of health insurance since 2004, and I have been a managing director CEO since 2005 till date. Within the last 19 years that I've been in this sector, I have represented the health maintenance organizations on the Governing Council of National Health Insurance Authority. As we speak today, I'm on the Governing Council of Nigeria Employers Consultative Association, that's NECA, and that is the umbrella association of Nigerians or organized private sector in this country, strategically interfacing with the government to enhance the ease of doing business in this country and also ensure that the organized private sector are given the right platform for them to function optimally. I've also been able to be the spokesperson for the Association of HMOs in this country for 4 years, and that is strategically creating top-of-mind awareness about the benefits of health insurance in this country. I would like to say that I've also been opportune to traverse the globe, looking at health insurance from a very global perspective, and that has actually exposed us to the fact that it is the general concern of all nations to ensure the well-being of all people back home. And whatever you see us discussing about health insurance as we speak today, it has to do with ensuring the well-being of Nigerians. Why I talk about exposure globally is because in the course of our going abroad, we interface with a few Nigerians, and we discover that part of the informal flow of funds from the diaspora back home is majorly sent back home to provide healthcare services for their dependents back home. Unfortunately, most of these funds, most of the time, are never utilized optimally to procure healthcare services because of possibly the challenge of poverty. And we've frequently been able to interface with Nigerians back home to see how well they are. I remember somebody talked about Nigerians resorting to seeking spiritual intervention when the need arises for them to access care. That was not far from being true, but the fact that there's not always money in everybody's pocket. And the fact that the first law that was passed for health insurance to be introduced in this country was majorly focused on the organized private sector, which is called the formal sector, organized private sector and the public sector. So the health insurance program that was introduced in 2005 was basically to enroll the federal civil servants, their spouses and children on the health insurance program. And thereafter, we began to tinker with how can we expand this health insurance program so the people that are working in the informal sector, knowing fully well that about 80 to 85% of Nigerians are operating in the informal sector. This took us back to the drawing board. This also led to strategic partnership with the government and the regulatory agency, and that also led to the passage of the new law that was passed on the 19th of May 2022 to make health insurance mandatory for all Nigerians. And the moment that law was passed, we felt there was a need for us to quickly hit the ground running. So Ultimate Health HMO started talking to our partners in the United States, specifically from New York to Maryland, Boston, and other parts of the United States. And we even, in fact, as a matter of fact, the state of Maryland gave us an approval to come and set up a branch of Ultimate in the United States. But by the time we reviewed and unpacked the conditions attached to setting up a branch of the HMO, we felt that, and looking at our cost-benefit analysis, we discovered that it was not really going to be a good venture for us to go into immediately. So we went back to the drawing board again, we recalibrated the operational process, and we started to set up our office interfacing with the diaspora from Nigeria. Recently, we also went into the UK. I was actually in Leeds in April I was also in London, interfacing with Nigerian diaspora associations. We already set up this platform, but we also felt there was a need for us to take it beyond that level. And why we are here this afternoon is not to seek for investors, no, but it's basically to just look for Nigerians that live in the diaspora that can partner with us in the area of business development and strategic marketing, such that we can expose